Today we're starting first aid. And so with that, there's some terms that we need to learn. So if you can go to your slides, all right. First aid is broken into 3 different chapters: primary assessment, secondary assessment, and environmental. We're starting today with primary assessment. So components of first aid. The first term that you need to make sure that you are aware of is mechanism of injury. Mechanism of injury refers to how the injury occurred. We dealt with this a little bit on our tissue chapter, okay, when you guys were making your comic strips. So mechanism of injury is how the injury occurred. History. History of lots of things. What is the any conditions that the patient has, their name, their age, basic information. All right, like when you guys go to the doctor's office and the nurse is talking to you and asking you all kinds of basic questions, this all falls under that history section. The next term that we have is primary assessment. Primary assessment deals with life-threatening situations, which is where we will talk about in this chapter of first aid. We see CPR come into play, such things as like heart attacks. Primary assessment is going to be the things that you need to do immediately to figure out what's wrong with the victim. Secondary assessment is less life-threatening. Okay, it's usually you've already ruled out all the bad stuff. There's no CPR, and it's a little bit more slower paced, getting to figure out more specifically what's wrong. Our next term is vital signs. Okay, you guys have all had your vital signs taken when you go to the doctors, different things like your blood pressure, your heart rate, your body temperature. All those fall under the vital signs chapter definition. So when you're working with any victim, you have to have consent, okay? And what consent is, it's permission to treat, okay? What we see in athletics is every athlete has to sign a consent to treat form. So every time an athlete comes into the training room to get looked at, we already have that consent form on them that says that we are allowed to do that. In first aid, if you do not have that already established, you have to ask the person, is it okay? Can I help you? So you would want to go up to somebody that you are unfamiliar with and state your name and your training. My name is Coach Tice. I'm first aid and CPR certified. One thing that's important to understand here is if the victim is unconscious, okay? If they're unconscious, they cannot answer you. They cannot say, yes, please help me, or no, do not help me. So if they are unconscious, we have what we call implied consent. And what that means is if they were awake, they would say they would want your help, okay? So we go ahead and help them immediately. Something that's important to follow, but might be kind of hard to grasp sometimes, is that somebody can refuse your help and you have to follow their wishes. If you approach a victim and they say they do not want your help, you have to follow their rules because you do not have their permission. Here's a quick video on consent.
Consent is a basic component of many types of everyday encounter, but it is particularly relevant to the interaction between an individual and a healthcare professional or someone acting on their behalf. This is because without consent, many actions that are an integral part of healthcare, such as medical examination or treatment, are unlawful. For example, in a treatment setting, consent is required when a person is asked by a healthcare professional to agree to an examination, treatment, or care. In research, consent is required when a person is asked to take part in a research study or to allow their identifiable personal information to be used for research purposes. When a person seeks another's consent, it shows that they recognize that people should be able to make their own autonomous decisions. It shows respect for another's right to self-govern, to control their own destiny. The concept of informed consent builds on this idea and stresses the importance of giving a person making a decision enough relevant information to enable them to make meaningful decisions about themselves and their lives.
Okay, so we have just watched that video. And now we're going to keep going through some terms that we have. We see a couple new terms in this chapter, like a sign. Okay, a sign is going to be some type of clue that you can witness as a rescuer. So my examples that we hear is sweat. I can physically see somebody that is sweating. Breath, I can look at their chest, see if it's rising. Odor, I can smell. Okay, their body temperature, that's something that I can put a thermometer on them and see. Those are all things that I can physically see. The next one that we have is a symptom, and this is where things get a little bit harder because a symptom is something that cannot be seen. The victim has to tell you about it. So if, for example, pain, you cannot see pain. Okay, you can see my face squinched up, you can see me rubbing something, but you cannot see the actual pain. Same thing with nausea. I can tell you that my stomach doesn't feel good. I can tell you that I feel sick to my stomach, but you can't actually see that. The same thing with anxiety. So a symptom, the person has to tell you. A sign, I can see it on the victim. Okay, we already talked a little bit about secondary assessment. Remember, those are not life-threatening conditions, but that still require first aid. An unconscious person would be somebody who is not responsive. All right, they've lost the ability to move, to speak. Sometimes they can still hear you, but they can't give you any answers. Okay, and so remember, this is where we have implied consent. So the first part of primary assessment is dealing with the ABCs, okay? And the ABCs of first aid is airway, breathing, and circulation. These three things are vital to making sure that somebody is staying alive, staying conscious, trying to figure out what is wrong with the victim. So we want to make sure that we establish what's going on with these three areas immediately, okay? The order of evaluation is crucial, and what that means is it's more important to figure out what's going on with the victim with that airway, breathing, and circulation over something small like a broken bone or like a cut, a wound that they're bleeding from. So the first thing that you're going to do is assess responsiveness, lightly taping and shaking the victim. We're going to see this in a video, and you guys will practice this. But the hey, are you okay? Next thing that you're going to do is you're going to assess the airway. Are they breathing? Okay. We'll figure out how to go from here, but that's going to be important. Are they breathing? If they're not breathing, what are we going to do about it? Do they have a pulse? Okay, we will check and see, does the victim have a pulse? And then the last on that list is bleeding, okay, because if the bleeding is less important than if they are not breathing or if they don't have a pulse. Those two things take priority. Our next slides, situations that are considered life-threatening are those that require CPR. If they're not getting any air, okay, or they do not have a pulse, that is when we would do CPR, okay. Whenever there's a life-threatening situation, EMS should always be called, all right. Ideally, somebody else is around to help you. So one person is giving care while another person is calling 911. It doesn't always work like that. So the quicker you can call 911, the quicker that there will be the ambulance there to help you. So kind of making sure that you have established what's wrong with the victim and you call 911 immediately. Here's a quick little video on primary assessment that just shows those first couple steps.
Sir, are you okay? Sir, can you hear me? Sir,
No
can you hear me?
response. No pulse,
No rise either.
no breathing.
Okay, so
Simulate any breath.
yeah, do you have two rescue breaths? So head tilt, chin lift. Make sure he's still not breathing. Give two rescue breaths, not your mouth and that sir.
Okay, so in that video, it was very short, but it was showing the different assessing your responsiveness. You tap the victim, shout, hey, hey, are you okay? They're either going to stir, make a noise, or they're not, okay? And that's kind of where we go from there. So checking that responsiveness, tap and talk to the victim. You do have to shake them, okay? You can't just barely touch them, all right? Hey, hey, are you okay? See, do they make any noises? Does their eyes open, okay? That is your first part of your primary assessment. After you tap the victim, you do want to go into the ABCs. Remember, if you do have an unconscious victim, there are several things that might be causing that. There's some listed down here at the bottom. They could be accidentally poisoned. They could have respiratory arrest, meaning they're having trouble breathing. Cardiac arrest, they're having a problem with their heart. We have hemorrhaging, which is internal bleeding. They could be having a diabetic or heat or cold related condition as well, okay? So there's lots and lots of reasons why somebody could be unconscious. Always activate EMS when somebody is unconscious. 911 immediately, okay? Once you assess your victim and can tell they are unconscious, stop what you're doing, go call 911. Okay, the unconscious athlete must always be considered to have a life-threatening condition, and that could be anything on those lists. It could be something like a cervical fracture that we would see in athletics, okay? You can be unconscious from a blow to the head, all right? It could be shock from something else. Either way, it's an emergency, all right? 911. So here's some different guidelines for dealing with an unconscious person. It's kind of, there's a lot of things that kind of come into play here, okay? If you have to be able to establish that airway, breathing, and circulation. So if the person is laying on their stomach, you have to be able to get them over to their back so you can get to their mouth, okay? You always want to suspect that there's a problem with their neck or their spine because you don't know what happened to them. If you move somebody that does have a neck or spine injury, you could cause them to be paralyzed. It could make things worse. So there are some proper procedures to go about this. Okay. When you see the word supine here, if the athlete is supine and not breathing, you want to establish ABCs. Supine is going to be laying on their back. That's the best case scenario. But if you see them prone, which is laying on their belly, you do have to do what we call log roll, okay? And we're going to practice this in class. You do have to log roll the victim over in order to be able to get to their mouth for the establishing those ABCs. Call 911 immediately, okay? This is the best case scenario. This shows the victim that's laying prone, okay? They're on their belly. We cannot do CPR. We cannot establish any airways because we can't get to their mouth, not only because of the face mask, but because they are on their belly. So you do have to roll them over in order to be able to get to that. Our next video is going to pick up again on the specific ABCs. We're going to break each component down and see how they work individually.